Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
Hello, Nita Valens. Can you hear me okay?
I hear you just fine.
I do,
Can you hear
but
me?
I'm on, believe it or not, my perfect iPhone because my microphone's not working.
Wow. Well, we won't do a commercial for Apple, but it's great to hear your voice. And we're going to help a lot of people today. How are we going to do that?
We're going to teach them how to heal their bodies without surgery. It's been the white horse that I've ridden for the last 25 plus years in medicine. And it's something that works on most people. And it's so easy. It's injections instead of knives. Who wants to put a scalpel into their body when they don't need it? And I know there's disagreement between me and orthopedic surgeons, and that's okay. We still love each other. And we do. I have a lot of friends who are orthopedic surgeons, and, we talk about this. They think what they're doing is right, and they think what I'm doing is wrong, and vice versa. I don't think that people should be operated on when they don't need to be. There's a big space for people getting operated on. If you break a bone, and it's sticking out of your leg, you better get an operation right away. And obviously the other types of surgeries, cardiac and abdominal and everything else, are very necessary. But I love orthopedic surgeons. I don't love all the surgeries that are being done. The studies that are coming out are showing that whether you have a surgery or not, in about 6 months later, you're going to be in the same boat. So why do something that's invasive and may actually hurt you? I've seen way too many sequelae. Sequelae means things that happen after an incident. And in surgery, the surgical sequelae can be very, very severe. We've all seen them. We all have friends that have had them. I have patients in my office all day long, really, who have had failed surgeries. That's why they come to me afterwards to see if there is an alternative to surgery. And in most cases there is, if it's orthopedics. If you're having musculoskeletal pain, meaning neck pain, back pain, whatever in the body, all the joints, the shoulders, the knees, the hips, toes, fingers, elbows, hips, yes, hips. And people come in often with a labral tear in the hip. Labrum means lip in Latin. I took Latin 4 years, so it's helped me in medicine. And if you Google labral tear or labrum tear on Google and look for the research, you'll see these studies do not come out very well. Same thing in the shoulder. I have a labral tear in my shoulder, but I'm not having any shoulder pain. I can play golf, I can throw a ball, I can pretty much do whatever I want to do, push-ups. And my shoulders are fine. I have tears that have been documented in my right shoulder. There is a subscapularis tear, supraspinatus tear, and a labral tear. I've injected those. I no longer have pain. Did I? I did. Okay. But I inject myself. I know people think that's very crazy, but I trust myself more than I trust other people. This is a very, 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 very detailed type of a procedure that's done. It's called regenerative medicine, and you got to have skills to do it right. You've got to be intuitive and find the parts of the body that are the pain generators. So what I'm going to start off with, Nita, is to get some callers if we can, and then I'll go into more about this. We use platelets and stem cells to regenerate the body, to stimulate new tissue to grow. And that's been studied over and over and over and over and over. There's probably more research going into this area of medicine than anything else. There's more people taking courses on it and giving classes on it because it makes sense. You want to, in medicine, do the most conservative thing, not the most invasive thing. So Conservative, simple. Do injections. That's easy, right?
It's easy. Shall we
That's
give
it.
the phone number?
866-870-5752. You can call me right now. As Dr. Jean used to say, live and local. Call us and talk to me right in the studio right now at 866-870-5752. And I will talk to you right now. And if you call in, I'm going to give you a copy of my book, which is, what's the name of it, Nita? You have it in your hand.
Stem cell and platelet therapy, regenerate, don't operate is the byline. It has actually 264 scientific studies, and the foreword is written by Suzanne Summers.
Yes, the lovely Suzanne Summers. So there's tons and tons of research how platelets and stem cells can heal the body, and there's research on how surgery actually can hurt the body. And I know that people listening to this show right now, there's many of them that are listening because they've had a failed surgery. And I'm one of them. I had a failed shoulder surgery when I was in medical school doing orthopedic surgery. And I literally begged my boss, my professor, to do the surgery because I was in terrible pain and from a weightlifting injury. And he did the surgery, and it came out bad. He's a great surgeon. I trusted him. It's just, I don't think it was his fault, but I think he nicked a vessel, and my arm blew up like a balloon. I had a fever, and I thought it was infected. I was terrified. It never healed. It took 4 years before I learned about regenerative medicine in my residency at UCLA, and I tried it on myself one night, and the next day, voila, my shoulder was completely healed. Now, don't think it's going to work on you like that. It does with some people. I've been very fortunate. I've learned how to inject. I did my knees with platelets and stem cells. I've done my shoulders. My elbows I've injected. I've injected my wrist. I've had some of my friends inject my neck and back because I can't reach there. And overall, for me, this doesn't mean it's going to work on you this well or this easily. For me, it's worked every place that I've used it in my body. And I know, I broke some ribs, and I used it back there too.
And you're a sports guy.
Well, yeah, I don't like to sit still. I don't like to sit still. I like to be on the move. And I've been known whenever I go anywhere to run instead of walk. And it irritates my wife. She goes, let's go for a hike. And I'm running up in the mountains. And,
let's give the phone number again. It's 866-870-5752 right here in the studio. You can speak live to Dr. Darrow. It's like a free consultation for your orthopedic pain.
Yeah.
Don't pass this up.
Yeah. I'm going to give out the number again. Write it down. If you're driving, probably smart to get off your Bluetooth and pull over to the side of the road. The phone number to me in the studio right now is 866-870-5752. If you want to call the office, there are people there that can answer your questions also that we don't happen to get to on the show. And the number to the office is 800-300-9300. That's 800-300-9300. If you want to watch these procedures, I have videos all over YouTube, and they're on my website. You can, if you go to YouTube, you can look up Marc Darrow, MD. That's MarcDarrow, MD. Or you can just go to my website, and there's places on every page that you can email me from that website, which is really cool. I answer every email every day. And the website name, get ready to write this down, is www.jointrehab.com. That's www.jointrehab.com, and I will answer your emails. You can watch videos of me injecting necks and backs and doing stem cells and PRP, which is platelet-rich plasma, and all these different procedures we do. We do a lot of amazing things. If you have carpal tunnel syndrome, we can do a hydrodissection of that median nerve in the carpal tunnel in the wrist. That's another procedure that I do. And for that, I use D5W, a very simple diluted dextrose solution, which literally pushes the tendons away from that nerve that gets irritated. So we don't use steroids on that. That's what a lot of doctors do. Steroids are great to get rid of pain very temporarily. So if you get a steroid shot in your shoulder, your knee, your hip, or wherever, you're actually destroying some cartilage. So please don't do it. We get too many people that have damage from steroid injections like cortisone. And if you don't believe me, go to google.com and put the words in cortisone and cartilage, and you'll never get a cortisone shot again. I mean, there are times when you have to do it, but very, very, very rarely. If someone comes in all bent over because they have a back sprain, the iliolumbar ligaments are sprained, and they can't get up and they're in excruciating pain, I'll use a light dose of a steroid, and they'll get up in about 1 minute and go, "How did you fix that? I feel so good." Well, I didn't fix it. I just covered up the problem. So be careful. Cortisone is not the way to go. Then I'll have them wait, come back in a week, and then we will start to do regenerative medicine, platelets and stem cells, one of the two or both, and see if we can actually heal that area, which normally we can do. So let's see. I'm going to give out the phone number to the studio again. We have a caller coming in. Right now, give me a call, please. I will send you a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And that's an amazing, amazing book. It took me 5 years to put all the research together. And it's got photographs of me doing the procedures and over 250 studies of how regenerative medicine works and how surgery can fail you. So Barbara from Topanga, thank you so much for calling. This is Dr. Marc Darrow. How are you today? Your hip is bothering you, I guess, huh?
No, actually, it's my husband who can't hear well enough to talk on the phone.
Oh, okay.
And to the radio. We are both 86 years old, and he has a degenerated hip. We've seen X-rays, and the top of the round bone that's supposed to be round is very angular and chewed off.
Okay.
And every doctor that we went to said, well, what I do is hip replacement surgery.
Sure.
Replace the hip. So then we went to another doctor, and he said the same thing. And then my husband said, he's 86. He doesn't think he's going to live a really long time, although he is in good health. But he doesn't want to spend a year out of his remaining years in pain and recuperating. And what if it's not wonderful and he will have blown a year of his life with this? And so I'm curious to know if regeneration can happen on bone that is degenerated.
It's a complex question because people think technically about medicine. In other words, they think there's something we can see on an MRI or an X-ray, and therefore you have pain. Okay? It's not like that. The reality is people bring in tons of X-rays and CT scans and MRIs, and I prove to them in 1 second, not all the time, but most of the time, that what they see on their image is not where their pain is coming from. So the big question I have for you, can your husband move his leg? Or is
yes.
Okay.
Started going to a physical therapist.
Okay.
Said maybe the pain is coming from his back.
Yes.
Down.
So we already have the answer that you've asked. The answer is it may not be the fact that the bone, as you say, is not round. Okay? It may not even be his hip joint that's causing the pain. So the first thing that we need to do, and God bless the surgeons, I love them, but they rarely touch the patient to examine. And I know that because I've been to surgeons. You know, I've been injured many times.
Never touched him. They didn't.
Yeah, and that's the problem. They didn't find out where the pain generator was. So then what happens? You get an operation on something and don't get better, you get worse because it wasn't the area that was the problem. So can we make that not round bone round again? No. Do we need to? No. We need to get rid of his pain and have him be able to have a better quality of life and maybe have him walk better and we can probably do that. In his case, I'd have to examine him like anybody else and see where the pain is coming from. A lot of people call their hip the area that's right on those little dimples in the back.
Yes.
And that's not hip.
Yes.
So a person, here's a typical scenario. Here's a typical scenario, Barbara. Patient goes to doctor. Doctor says, what hurts? Patient says, my hip hurts. Doctor gets an x-ray or an MRI. It shows arthritis, or maybe in your husband's case, some avascular necrosis in the hip. And then they say you need an operation. They replace the hip.
Yes.
The patient comes back and goes, that was a great operation, but I still have hip pain. And then the doctor finally goes, where? And the patient points to the low back. And then the doctor goes, well, that's not really your hip. We operated for nothing. So, got to be careful. If you go to a surgeon or any doctor, make them touch your body to see where the pain is coming from. And
Thank you so much.
Yeah, if they can't elicit the pain.
Exactly what we were afraid of. Yes. What he has said is that he can still walk up the stairs in the house, but sometimes when he's trying to stand, his leg just buckles under him.
Okay.
And he says, ouch.
Okay.
But you and I don't know where that comes from.
Even if it comes from the hip joint, I don't care. I think that we could help him. In his case, again, I have to examine him to decide if it's better for him to just do platelets alone or to do platelets and stem cells. At 86 years old, if that were me, I wouldn't be getting any kind of surgery anyway, because the body doesn't.
That's what we're thinking.
Yeah, I mean, if it's a cancer and it's going to give you another, many, many years of life because it could kill you right away, then I'd say go get a surgery maybe. But for orthopedics, no, I don't believe in that. And I'm not going to fight with anybody about it. Everybody has their opinions. My opinion is just my opinion. But I like to heal people rather than hurt them. And I was in line to be an orthopedic surgeon when I was young. And after my surgery on my shoulder that hurt me, I switched horses midstream, and I got out of orthopedics in terms of surgery, and I moved into regenerative medicine instead. And I've been very, very happy with my practice. I love my work. People say, what do you do for a living? I say, I watch people heal.
That's beautiful. Beautiful. Where is your office?
I'm across from UCLA, across the freeway on Wilshire Boulevard, West LA.
Not far from us. Yeah, not bad at all.
Well, I have
Okay,
people flying in from all over the world. So if you're around LA, it's funny, we get people who call the radio show and go, well, that's too far from me. I live an hour away. But we have people flying in all the time and driving in from all over the place. And it's worth it. It's certainly worth it to avoid a surgery when you never needed it in the first place.
Well, thank you very much. We'll call your office then.
God bless you, Barbara, and God bless your husband. And there's just from what you've told me, there's a very, very high probability we can make him feel better. No promises ever to anybody.
Thank you, Dr. Darrow, and thank you for your show. Much appreciated.
Thank you, Barbara. God bless you.
Thank you, Barbara.
Thank you. Bye.
So I'm going to give out the phone number right now. This is Dr. Marc Darrow. I do regenerative medicine. I've been doing it for over 25 years. I probably do the most of anybody on the planet. At least that's what they tell me. Busy all day, every day. You want to talk to me about it? Call me right now. 866-870-5752. That's 866-870-5752. If you give us a call now, I will mail you postage-free a book that I wrote called, what is it, Nita? Stem Cell and Platelet
Stem
Therapy.
Cell and Platelet Therapy, Regenerate, Don't Operate.
Yeah.
With 200.
And then again, if you want to catch me at the office, or just talk to my staff, I should say, you can call them now at 800-300-9300. That's 800-300-9300. And if you want to watch videos of these procedures, you can go to my website, www.jointrehab.com, www.jointrehab.com. And I want to also mention there's a new addition to the family. Dr. Thomas Grove is working with me, and he is very educated and very, very experienced in regenerative medicine and using ultrasound to guide needles. And this is very important for you folks. If you're going to get an injection in your body for musculoskeletal, make sure your doctor uses an ultrasound, because you can see into the body and you can watch where that needle is going and put it in the right place. So for many, many, many years doing this kind of work, when we'd get together at national meetings, and Vincent, hang on, I'll be right with you. There was a query, why don't hips heal very well? And the answer, we didn't find out for many years later till the ultrasound came along, was that we weren't putting that needle into the right spot. So if you're going to do certain areas of the body and you can't see where that needle is going, you're going to place that solution in the wrong spot, thinking it's in the right spot. So we use ultrasound to direct the needle. We can watch it go exactly to the right spot. Things like the shoulder, the hip, the knee, the joint space to get into there is so minuscule. If you're doing it blind means without imaging, the studies show you miss the joint 1/3 of the time, and that can cause havoc. It can cause a thing called incision and drainage, meaning that it blows up, looks like an infection, and then you have to cut it open and clean it out. So please, 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 if there's only one thing you come out with from this show, make sure if you get injections, your doctor is using an ultrasound. Vincent, you got a hip problem too. What's up?
Hi, Vincent. Are you there?
Yes.
You got to talk a little louder, Vincent. Scream at me. I don't care. You won't hurt my feelings.
Yes, I'm here.
Okay, what's cooking? Hello? Talk louder, please.
Yeah, I got a hip pain. They say that I have to have a hip operation.
Okay. Tell me more.
Nothing that I can't bend down, like put my socks on.
Okay.
And when I walk, sometimes I have an excruciating pain right in my hip.
Okay.
That puts pressure. And sometimes it goes away, but the pain is always there.
Okay. When you say your hip, are you talking about your groin area in the front of your body?
No, I don't have a pain in my groin area.
Where is it?
Right in my hip.
Well, you don't know what the hip is, though. God bless you. People call hip different things. Tell me where your pain is. Is it on the side of your leg? Is it in your back area?
It's on the side.
Okay, that's not your hip. That's called the greater trochanter. I want you to look this up. If you have internet, just put in Google and put in greater trochanter. I see this almost every single day. People come in ready for a hip surgery because they have some arthritis in their hip, and it's not the reason they're having pain. It's the greater trochanter. So look that up. Look it up on the top left after you find greater trochanter. After you click on it, there's a spot on Google that says images, and it'll show you what that is. That's not the hip joint.
Okay, greater. Is that two? Is T-O?
Greater is Greater. Trochanter is Trochanter.
Okay.
Trochanter. My mom, when I was a little guy, taught me how to spell by phonetics. We'd be walking around the house all day. Trochanter, whatever word it was. It was so fun. My mom was one of my best teachers.
Yeah, I don't know. She always is.
So if that's really the case, then the only way I'm going to know is by touching the area. I won't know by looking at an X-ray or an MRI. And if you had someone diagnose you by an MRI or an X-ray and told you need a hip replacement, that's bad medicine to me. I'm not putting the doctor down, because that's the tradition and the culture of medicine.
And what we're going to do is come right back with more of your calls at 866-870-5752 right after this.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.